Is it all right?
Yeah, you're very clear.
Okay, then, yeah, right.
Evergreen, as usual.
Thank you for the compliment.
Yeah, so many meetings is going on today.
Yeah, of course, you're right.
NACO is also having, Alliance is also having, UNAIDS is also having. Everyone is having
Same
today
day,
meeting.
all same day?
Yeah.
Okay.
Sir, 3 days is happening now.
Oh,
NACO
okay,
have
good.
some meeting, Alliance have some meeting. Everyone.
Is it after we announce this meeting, or they hosted earlier?
After the Trump's announcement.
Oh, yeah,
All
because you said withdrawing the funding has got ARV access issues.
Yeah, it's a big challenge now.
Right, right. Oh, you want to postpone our meeting for maybe some other day?
No, though we are 18th, no. I think Elango sir is there. And
Elango is not online.
I think Asa is there. Asa Ramaya.
Okay.
Yeah.
Okay.
Dhirendra Rawat is there.
Yeah, Raut I can see. Yeah, he's here.
Pooja Thakur is there. Pratik Rawal is there.
Where is Manoj Pardesi?
Manoj Pardesi, I think he will be busy in the meeting with the.
Yeah, right. Yeah.
Pooja Thakur has also joined now. Sumati. Most of them we are not aware, like Raman Chawla has also joined.
Okay. We have 22 participants now.
Yeah. We can start. They will be joining. Abraham sir has joined now.
Yeah, I'm already there.
Okay. We have 22 people, and I think I'll begin.
Yes, sir, you can begin.
Sir, before starting, can I give a brief introduction about you, about our speaker for today?
Please go ahead. Who is this? Sophia. Okay, please go ahead.
Yeah, I'm Srishti. I'm a part of Global Alliance for Human Rights India. So yeah. Okay, good morning to one and all present over here, and good morning to everyone who has joined for this meeting, this important meeting. To begin with, I would like to give a brief introduction about our renowned. We are really honored to have you, sir, with us. So, starting, I would like to give a brief introduction about who our speaker is. Dr. Joe Thomas is one of the leading social commentators on HIV and AIDS in Asia Pacific region. He has contributed towards HIV and AIDS related program and policy development in Australia, India, Indonesia, East Timor, Philippines, Thailand, Vietnam, China, Hong Kong, Mongolia, and Rwanda. He has served as the HIV and AIDS advisor to the Ministry of Health in the East Timor and served as the technical advisor to the World Health Organization and as the regional manager of the Northern Territory AIDS and Hepatitis Council in Darwin, Australia. For the 8 years, he has edited two most popular e-forums known as India AIDS and India AIDS Asia e-forum. Dr. Thomas is the founding co-convener of the largest Asia regional multi-sectoral alliance of the HIV and AIDS response, Asia's People Alliance for Combating HIV and AIDS, APACHA. He is the author of 2 books and has published several articles in the peer-reviewed journals. As an Indian immigrant living and working in Australia, Dr. Thomas is acutely aware of the vulnerabilities of migrant and other marginalized population groups and its implication on their health and and Well-being. He is the founding director of the International Center for Health Equity, India, based in Melbourne and Australia. Sir, we are really honored and we welcome you to this forum. So the floor is yours, sir. Thank you.
Thank you very much. And it was a very generous introduction. I'm one way a bit embarrassed to hear that long introduction. You should make your introduction brief, 2 minutes, because the focus is not necessarily on the speaker. Anyway, thank you very much for your introduction. Maybe I'll begin with a story of my association with positive groups. My first meeting was let me put it in a different way. The first advocacy and leadership training of INB Plus was hosted in 28 years ago. And I had the privilege to host it in Hong Kong. And why in Hong Kong? This is a part of the story. Because UNAIDS was not very confident in hosting that training program in India because of the stigma and the discrimination associated with being a positive person. And I'm glad to see that some of those people attended that meeting 28 years ago are here today, is on the forum right now as part of you in this meeting. So I acknowledge that, and also let me acknowledge the people who are not here. And they moved on, they passed away. And I acknowledge, I'm not naming anybody, but there are people who the Indian Positive People's Movement began about 28, 29 years ago. So I had the privilege of traveling with them almost from the day one. And we remember that, and some of you, you may remember that your Hong Kong training program. And that time, India, we couldn't even host a training program. From there, we moved so far here. Now we are having a public meeting, an online meeting. We never thought about this can happen. So this is the departing point of my discussion. And if you'd have looked at the title, there are a few words. The words begin with number one, the community. Second word is about leadership. Third is about access to healthcare. And the fourth is about role of GIPA. And the challenges, opportunities. So this is actually the structure of what I want to talk to you about. And I'm not making a formal classroom presentation. This is basically a dialogue, interaction, and exchange of views. And why we are meeting today here, I had also had the privilege to talk to many of you personally. So one of the idea came up, we need to do something about reviving the movement of positive people. So this is the main objective. So what needs to be done to revive or strengthen the association of people living with HIV/AIDS, and it can be of various forms, whatever forms. So what is how to take it forward? This is one of the concern. Second, let me acknowledge that there are organization difficulties like any other organization. If the Positive People's Organization also got a misunderstanding, difference of opinion, and also there are allegations, accusations. All this is I acknowledge, but I'm not here to say that so-and-so is a good person, so-and-so is not a good person. That is not my job. My job is to work with you how we take it forward. That's number one. Number two, what we can do to take it forward, and what are the opportunities and why it's important we look at to take it forward. And at the beginning, you mentioned that there is simultaneously many meetings going on because of the decision taken by Trump in the United States. Imagine a decision taken by head of the state in the United States, and all over the world we have to worry about it. And many of the people living with the infection, their access to treatment is threatened by just one executive order. This is also a reality which we have to keep in mind. So this gives an idea that unless we strengthen our understanding about the situation, and earlier we used to say that advocacy. Now even using the word advocacy has got difficulties for many people in the country and outside. So instead of calling the entire exercise as an advocacy, Nowadays we call it as policy dialogue. We dialogue about the policies. So instead of access demand, we are talking about understanding about policies. So this is the one major shift. Keep in mind that we may not talk about advocacy training, but at the same time, we can talk about training for policy dialogue and what are the areas we should have the capacity to engage in a policy dialogue. So this is a shift in the wording. It's a strategic shift and also it's a survival shift. So just let me acknowledge that. Again, when we talk about how to strengthen the organization, now we know that we have positive groups association in more than 100 plus districts. Remember, we have almost 560 districts. So unless we have the representation in practically all the districts, the capacity to dialogue on policy issues may be weakened. So as a target, if you want to look at it, we may have to find a way to expand the influence and presence of at least one spokesperson at the district level. That means we are talking about increasing our advocacy, our expertise to all the districts, that is 560 districts plus. So that means whichever form we talk about positive people's association organization, it should have a huge reach. And this reach is phenomenal. And I don't think anywhere else in the world, we can claim, we can even dream about this kind of a reach. So remember that you have a responsibility towards expanding this to all the districts. That's one of the, I would say, responsibility and opportunity. And now let me move to the other issue. Why positive people should be worried about thinking about organizing, strengthening the positive network. Let me compare the HIV issue with the TB program. TB program, if you look at the investment about TB program, extensively invested, but the success is not that great if you compare with positive activism. And one reason is that the TB program is without the involvement of people living with TB. So remember that people living with the infection, they have a great role to play. This is another lesson you have to remember. Third, what we learned this 28, 30 years of positive people's advocacy is that advocacy is the strength for survival. Those who are skillful in advocating, those who know about different aspects of infection treatment, their likelihood of survival is more. So remember, advocacy is about life. Strengthening your advocacy is about strengthening your capacity to live. I'll explain it why it's important. When you talk about the positive people's involvement, now many people say that now many of the positive people, they're worried about being aging. Many of the people are now 55, 60 plus. In the aging intervention, we talk about the key to aging is being active, not necessarily medicine. Those who are active, the aging population, if you are active, you will be healthy. So healthy aging is propelled by active aging. So that way, this is one lesson you have to remember, that positive group, if you're active, that is going to contribute towards quality of life, because that gives a more understanding about your survival, your treatment issue, your capacity, and also it gives a tremendous self-confidence and power. So this is one reason, a justification why you strengthen your capacity for advocacy or / policy dialogue. So again, quite often when you talk about in a public forum like this, your take-home message or a conclusion is given at the end of the session. So let me conclude, let me give you the message upfront about it. What is the message of today's presentation? Number one, positive people should find a way to strengthen your association on a national level. Number two, advocacy is life. Number three, what are the components of advocacy? Number one, you should know about the treatment. You should know how treatment is dispersed. You should know what is the cost of treatment. You should know who is manufacturing the treatment. You should also know that different generation of medication, first generation, second generation, third generation, now even talk about fourth generation. Understanding about this different generation of medicine is important for your own survival. So this should be part of your learning, your policy dialogue, your advocacy, self-advocacy component of that. And most importantly, for example, how the international policies are influencing the issue of access to treatment. For example, the Trump decision is going to impact on positive people globally because USAID is one of the great, largest contribution to Global Fund. And the Global Fund funding is going to cut down drastically all of a sudden. This will have impact on access to treatment. So if the government of India is going to say that, sorry, we don't have money from Global Fund, we are going to reduce our ARV treatments, then there is a serious problem. So this is the issue which you may be able to analyze and come out with an advocacy strategy and also to analyze it. So this is some of the initial introductory or a concluding statement. I just wanted to put it across. Now, let me just acknowledge the fact that positive people, I know most of you personally, the personal issues of conflict, the issues of allegations, I'm not making any reference about any of that, but I acknowledge it is existing. But how do we solve it? That solving the problem also, I'm not proposing anything. But I would suggest one thing, because right now we have different organizational framework. Probably you should think about creating a national federation structure, Indian Federation of Positive People, and all the district level network could be part of this. And also remember that try to expand your Positive People Association at the district level. But then there is a dilemma of the positive people. There is a difference between an NGO model and there is a difference between NGO model and activist model. The strength of positive people is that is an activist mode of association. But whereas for the matter of survival, many of the activists are becoming NGO workers. I'm not saying the good or bad. Both has got different orientation. Both has got different objective. But one of the challenges today we are facing is that how do you balance these two? If you look at about 100 district level networks, most of them operating as an NGO model. But the moment you take the NGO model, your capacity to advocate is compromised. So I'm not saying that what is the solution. Maybe this is the one issue which you need to discuss about it. And also my understanding is that this discussion, this national level dialogue is an initial preparatory dialogue towards a physical meeting sometime in March, April, most probably in Delhi. So today's meeting, we also may discuss about what are the possible agenda for this meeting. So number one, I'm sorry, my Hindi is, I can't survive. I know somebody told me to speak in Hindi. I really apologize. Hindi, I'm unpad. Let me be very frank about it. The other language I can speak is only Malayalam. And Malayalam also, I'm not a good speaker. So in one way, I'm largely an unpad person. I'm sorry about it. Let me acknowledge it. I can post this if somebody wanted to translate into Hindi. What I can say is I apologize. I can't speak Hindi because I don't know. I barely understand something. And I can't hold on a conversation. If anybody wants me to stop it and translate what I'm saying, please feel free to do that. Should I continue or should I arrange for some translation or summarize it? I can see that there are 2-3 people suggest speaking Hindi. I'm sorry, I can't. I don't know Hindi. I'm unpad person in Hindi.
And if you have any questions during this time, please just ask your questions to me. Also, you're most welcome.
Okay, maybe the solution is that whoever got a question, whoever got a question, please write it in Hindi, no problem. I think Hari or somebody will help me to translate it. Or Rawat can help, I suppose. Or somebody, your question, please ask in Hindi, no issue. We will answer to that. Okay, limitation of NGO model. Okay, that question I'll come to that. The NGO model and the activism model. The activism model is more dynamic. You can take up new issue, and also activism, you have different opportunity to express yourself. But NGO models is more of a professional. You have your outcome, you have very specific objective, and your financing is linked with activities you do. So you may not be able to do certain things beyond the objective of the NGOs. Sorry, okay. So this is one of the limitation of NGO model and the strength of activism model. But both of us got limitation and strength. But how do we combine these two together? This need to be discussed because this is very specific to the Indian condition. I would say that one of the agenda for our March-April meeting is how do we combine activism model and NGO model, and why we should combine this to take it forward to the district level, because how to expand it. And expanded positive group network covering all the districts, and we are talking about maybe 50,000 members, more to 1 lakh members. This membership is an important factor for advocacy. And also another agenda for our meeting is, number one, we may have to come out with an advocacy or policy dialogue agenda. And that should have minimum, and we should create a new group of leadership, because there are new generation of leadership is coming up, but they didn't receive the training as the early generation received. So one of the objectives is to come out with a training program for the new generation of positive people. And what should that training program should contain? Number one, advocacy about treatment I mentioned, or policy dialogue about national health policy, how that is impacting on access to treatment. But when you talk about positive people's access to treatment, I will also say that positive people got an opportunity to talk about access to treatment on a national level, particularly for improving access to primary care. Because many of the positive people, even though they go to the ARV center, they also go to primary health center. Whether they may be able to get the positive people, get the adequate service from the PHC. So this should be one of your advocacy you have to look at it. And the other issue is about financing models of treatment. Because right now, majority of the treatment access is coming from the government supported ARV treatment. So this should be continuing. And that is also going to be reflected in the coming budget. So do we have enough time to even advocate for ensuring that at least the ARV treatment should continue as it is, and expanding it for the next generation of treatment, at least for certain level of population. This is the third agenda which we had to think about it. And also I would say that positive people should think about creating knowledge as a methodology of your advocacy. Means, I would say that in academic terms, focusing on research on your own history. There is a need for writing the positive people's history. We know that, I mentioned, and I'm associating for the last 28 years with the positive movement. So somebody need, and that should be written by the positive people themselves, your own history of advocacy, your own history of survival. And in that process, the experience of stigma and discrimination, because that's the one issue impacting on the quality of life. So when you meet in March, think about what research needs can be brought in, what research can be implemented. And as an agenda, I would say that positive people's history should be one of the issue of agenda. Second, what should be the minimum essential training for the new generation of positive people? And I initially mentioned that it should be about access to treatment, access to medication, access to financing models of this one. And also maybe some of you may remember that INB Plus did a study on the extent of stigma and discrimination. And maybe it's a time for following it up the methodologies of stigma, the methods of exclusion of positive people from treatment, and also now the exclusion of positive people from authorities of power. For example, we have a treatment officer in all the ART centers. And how do they exercise their the treatment officer in relation to positive people's needs and aspiration who are coming to a treatment center? So this may be one issue, the role of the advocacy officer associated with the ARV center. They're doing a great service, I have no doubt about it, but it's a time to look at their job description. How do we integrate the needs of positive people into the advocacy on day-to-day ARV center? So these are some of the general introduction about it. And challenges, if I put it across, financing model is going to be a challenge. Now, second, to what extent HIV positive law is being implemented? It's a great challenge. Even though we have a law, to what extent that implementation of the law is being practiced in today's condition, that's a great challenge. And how do we expand our strength and opportunity to all the district level? Again, I'll re-emphasize that's a challenge. At the same time, that's an opportunity also. And I mean, I'm not taking it to I mean, I may be able to spend more time if there are more questions, but maybe our message should be, we have to channelize, we have to crystallize our message. Our message should be directed to the government, research institutions, academic institutions, treatment institutions, ICMR, Ministry of Health. So we may have to find out what is our target population, what is our message. This also should be an agenda which we should think about in the March, April meeting. So in general, as a summary, what I want to tell you is that positive people got an opportunity to strengthen their networking. I mean, maybe in a federation level, it's an opportunity and responsibility towards positive people themselves. And also there is an opportunity to strengthen the primary healthcare in India in the overall context. You may be able to keep an eye on strengthening the primary healthcare, strengthening access to treatment in the general sense. So remember, advocacy is not it's not burdensome, because if you are an advocate, and probably it will contribute towards quality of your own life. This is the evidence you're noticing that. Quality of life is influenced by your capacity to network, your quality of your network and your skill, your capacity to reach out. So that way, advocacy is life, advocacy is survival. Just keep that in mind. So advocacy is not a burden, it's an opportunity. And again, my point is that there is a great deal of expertise, skills, and experiences among with you. You have now 37 people. You collectively bring it together. In the national level, there is no such strong people with, or the patients group, there is no such patient groups in India. We have medical associations are here, doctors associations are there, but they look at treatment from a medical perspective. Positive people look at treatment from a what determine, what contribute towards treatment, what is the barriers to treatment, a totally different perspective. And that perspective can be given only by the positive people. And because there is no other national network of patients, INP, the network, positive people's network is also contributing towards treatment advocacy in general. See, for example, today, any organization called for the patient advocacy meeting, you may not get 40 people for a meeting, an online meeting. So this is the strength of positive people. I acknowledge it, appreciate that, that particular strength. So my concluding statement is that let's work towards our March, April meeting. And also and that meeting should have the agenda probably 2 days. One day is a training component for the new generation of positive leaders. And it is about, we may not even call it as advocacy anymore as a strategy, because we know that the word advocacy is becoming that itself is calling for sometimes stigmatizing and discriminating glare from many policymakers. So we put it to them, we'll say in that skill building in policy dialogue. If you want to put it in a different language, as a strategy, I would suggest that this one-day session is about skill building for policy dialogue, capacity building for policy dialogue for the people living with HIV/AIDS and the leadership training program. So this is one thing. And the agenda is, one is, how do we strengthen our network? Number three, let me acknowledge again, there are difference of opinion, there are conflict, there are some people, they may not even talk to each other, but this should be brought in, but that should not be deflecting our agenda for the March meeting. I agree there is an issue, serious issue, but we should have a different mechanism to solve our problem. And I'm not saying that how to solve this problem, but maybe a small team work on that. What are the issues? What are the problem? How do we solve it? And maybe that working group can submit their recommendation to this March meeting. This is my suggestion, but I'm not here to tell you how to solve a problem. But I can acknowledge that there is a different problem, and that problem is taking the energy and attention from the core issues of people living with HIV/AIDS. So that's the one thing I want to highlight it. So again, let's look at the agenda a little more carefully.